And bonjour, this is Bruno LARVOL, and you're listening to our weekly podcast for LARVOL CLIN, Build in Public. And I'm putting my fancy hat on, foam, fast, and on a mission. That's us, Judith. We are fast on a
Okay.
mission to help our wonderful customers with the CLIN platform, the Wikipedia of clinical trial data that has application both for CI, for clinical development, and for many other functions within the pharmaceutical industry. Judith, thanks for joining again.
Always, Bruno. Happy to be here. Hi,
Uh,
Bruno. Hi, everyone.
I'm just came back, of course, from ACR. So we're going to talk about ACR today. That's a topic. We're going to show you how CLIN can help both prepare before, during, and after a conference like ACR. Before I give you the microphone and you're going to share your screen and give us a quick demo, I want to tell our audience if you have questions, please post a question on social media. We'll respond. We'll try to respond live. And if you like this video, you can support us by subscribing, liking, and reposting. So, Judith, your show now. I'll jump in as I need to, but give us a walk through the conference function
Mm-hmm.
of CLIN.
Sure. Thank you, Bruno. So in here, we have landed under the conference tab in CLIN, right in AACR 2025, which has just finished. So we have in the first analytics page, the top trials. So we are showing the top trials based on the number of tweets. So people, our DOLs that we track around more than 4,000 DOLs, they are being tweeting and talking about these abstracts. So they are gonna be, we are gonna be keeping track of those tweets and those posts, and we are gonna be rating them based on sentiment analysis. So, and this is powered by AI. So you can see in here that in Keynote 689, there have been most of the posts associated to that one disclosure, and there's been some practice changing around it. And then we have lots trailing then right below on other trials, which have been also lots of comments about it. Then if we move on, we can see other analytics. So in here, we are seeing who are those DOLs which we are tracking that are talking about AACR and the disclosures that have been published there.
I have to say, each time I see that analytics, I love it. I'm a little bit fascinated by it because it gives us the style of every opinion leader. You can see the ones that are very opinionated, right? And it's fascinating to me to compare this. Some are posting a lot, but not giving a lot of opinion. Others are posting a little but strong opinions. Some very positive, some negative, some neutral. So I always find it fascinating. And the game we play sometime internally is to hide the name of the DOL and to try to guess which digital opinion leader has that signature. And there's a few people we recognize easily.
That's a very good point indeed. We can see how, thanks to that sentiment analysis, which is the general view around AACR, thanks to the posts that those opinion leaders have been posting around those disclosures, right? So we can see there, there's been like quite some good practice informing, practice changing, and so positive impressions, right?
I have
Posts
something to say.
around AACR.
We're better, much better than our competitor for two reasons. Well, okay, three reasons. Number one, we track only verified oncologists, essentially all of them, 6,000 of them. Of course, most of the activity come from what we call the top voice, the most active, most respected one. But still, we track essentially every oncologist who is somewhat active on X. That's the first reason. The second reason is that it does not matter if the hashtag ACR is used on the tweet Other platforms require that hashtag because they're completely automated. They just track the hashtag ACR25. Many often in a thread in particular, the hashtag will not be used. We get that. And the third reason is that we only include the post or reaction that specifically talk about data release, no general commentary. So it's a much cleaner, much focused analysis of sentiment. And of course, we use AI to have a very precise fourth reason. That's my infomercial here, right? AI is helping us extract the precise sentiment. And I'm very proud of how our AI has been fine tuned to do that very well.
Yes, definitely. Those are really good points. And yes, indeed, the ratings we are using right now to identify or categorize those tweets, the sentiment analysis, it's based on negative, not rated, mixed, positive, and where all the interest is lying mostly in practice informing and practice changing, right? So to know which are going to be the potential changes in standards of care, right? And what could be practice informing in the future, right? So we have a couple more analytics here in CLIN. So we could also check out which have been the top companies, right? And here we can see Merck, Revolution Medicines, and Roche on the top. Then we even have this cross-reference of the top trials by influencer, right? So we can see in here some first like negative reactions on this skyscraper across different influencers. So it seems like this may not have been good, like not the expected results, right? So, and we have seen like all other these postings on by different influencers, which may be practice changing, right? Those trials. More analytics, and in here the interesting point is that we could compare them with previous years, right? So in here we are having the top drugs, and if we were to compare it with 2024 and 2023 analytics, so Pembro has been reduced on the amount of trials and tweets posting about it, but we have then more iOS right below, and increase on Enhertu, and the divides there. So we can see this interesting comparison across different years. And the same analysis could be done both at MOA level as well as top diseases. So this year, HER2-positive breast cancer was high impact. Last year, in 2023, it was triple-negative breast cancer. Castration-resistant prostate cancer also highlighted this year, as well as bladder cancer. Okay, so I would like to go and check out some of the particular disclosures, if that's fine. So let's go to this first analytics, where we have the top trials and the tweets published, right? So let's go out to the keynote 689, which is the one which has got most of the tweets with practice changing on sentiment analysis. So let's get a closer look to that one. In this case, it's about adjuvant and neoadjuvant pembro in head and squamous cell carcinoma. And we can see in here that people are reacting very positively. Indeed, our top voices, such as Jixel Arun and Brian Bell. And the point is that they have met the primary endpoint. So EFS has been significant in this trial. So they are reacting very positively as practice changing, right? So this could be this has been a really good outcome on turnout of events for keynote 689. Then, and indeed, something that I would like to point out that in CLIN right now, AACR has just gone, and we already have under the trial 360 page of these trials, we have all the data already digitized, right? So we have the AACR 2025, all the KM curves are already there in CLIN, available. So in case you want to conduct any type of analysis, the data is already available there, both in terms of KM plot data as well as forest plot. So all data is already in our database. Okay. So coming back to the data presented in AACR, one of the other trials I would like to mention is that skyscraper 01, which we were seeing right before in the influencers by trial analysis. We saw that many of the tweets were negative. And if we were to get a closer look to that one, in that case, it's tiragolumab, so TIGIT, in combination with atezo, right? And this is in first line, advanced, unresectable metastatic PDL1 non-small cell. And we can see that all the thanks to the sentiment analysis, when it comes to a negative sentiment, we even narrow it down to which could be the particular reason why there's this negativity around that trial. And in this case, it's about lack of efficacy. And the reality is that PFS and OS, they did not meet the significance level, right? So in here, we can see by Dr. Amol, a post where we can see that for OS, the p-value was not significant, and for PFS as well, since per protocol, it did not reach significance as per the definition. So the turnout of events for this trial was not that positive, and indeed they will be requiring to check out which would be a proper subpopulation where to use this TIGIT type of treatments. And yes, finally, also would like to, for the good things comes in three. So maybe let's check out Vimian Lang 1. Which in here we have some practice informing tweets, and I thought it was interesting because we have this novel TKI that it's HER2 specific, right? So it seems like it has reported good ORR, like 72%, or well, 71, sorry for that. And it seems like promising. So it could be interesting to follow that up. Okay. Then, so anything else, Bruno, that you would like to add regarding the environment at AACR and all that you have met also with some of our DOLs? Wait, Bruno, we cannot hear you.
Oh, here we are.
Okay,
Yeah, so
sorry.
it was fun to be in Chicago for AACR, and me and a couple of my colleagues will be back at McCormick Center in Chicago for ASCO in 4 weeks. And so the message, maybe in closing, I want to leave for our audience is that if you based on this presentation, if you think that CLIN can be useful for you to again prepare for ASCO, during ASCO or after ASCO as a way to analyze what was discussed and navigate the data, please make a comment on social media and or reach out or message Judith or myself, and we would love to give you a fuller demo or to give you a pilot access to our platform. So we got to close on that note. We are nearly on time, and we appreciate everybody's support. Again, like, subscribe, and repost our content, please. Thank you.
Thank you very much. Have a nice day.
Au revoir.